and welcome to Medical Dialogues. I am Dr. Bhumika. Here is what I bring to you from the world of medicine. Cardiovascular complications now affect 1 in 7 pregnancies, AHA study. A significant rise in heart-related complications during pregnancy has been identified in a new study published in the American Heart Association's flagship journal Circulation. The research, which reviewed electronic health records of more than 56,000 pregnancies within the Mass General Brigham healthcare system from 2001 to 2019, reveals that cardiovascular-related health issues now impact as many as 1 in every 7 pregnancies, approximately 15%, including among individuals with no prior history of heart disease. The study focused on identifying the growing burden of cardiovascular complications such as heart attack, stroke, heart failure, blood clots, hypertensive disorders, and maternal death. Researchers observed that these conditions have increased steadily over the 18-year study period. While the rise was most prominent in individuals with pre-existing cardiovascular conditions, the upward trend was seen across all age groups and in people with no underlying health conditions. The researchers attribute this concerning trend to a parallel increase in major health risk factors both before and during pregnancy. The rise in these complications is likely influenced by growing rates of obesity, high blood pressure, high cholesterol and diabetes, the authors noted. Specifically, the percentage of pregnant individuals with obesity rose from 2% in 2001 to 16% in 2019. High blood pressure increased from 3% to 12%, high cholesterol from 3% to 10%, and diabetes from 1% to 3% over the same time period. Most of these health risk factors can be prevented through lifestyle changes or medication. Yet many of my patients aren't even aware they have these conditions or that they are at risk. If you are planning to become pregnant, I strongly encourage you to connect with a clinician early to understand your risks and take steps to reduce them. During pregnancy, stay proactive about your health. Listen to your body and your provider to address any concerns that arise. And don't overlook the postpartum period, which also carries important health considerations. Starting before pregnancy and continuing after birth, there are valuable opportunities to make heart-healthy choices that can help prevent cardiovascular disease and support long-term wellness, said Stacey E. Rosen, MD, FAHA, Volunteer President of the American Heart Association and Senior Vice President of Women's Health and Executive Director of the Katz Institute for Women's Health of Northwell Health, New York City. Thank you for watching Medical Dialogue. Stay tuned for most updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.